Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Now let's go into the topic of neuropathy and physiotherapy. Neuropathy is a term which comes from neurology. That means the medicine of the nervous system. Neuro is nerve, is nervous system, the neurosystem, the nervous system, or the central nervous system, the peripheral nervous system, the autonomic nervous system. These are terms which comes from, let's say, all the world of nerves, from neurology. So neuropathy refers to a problem of nerves. And neuropathy means it's a process which damages the function of a nerve. It's a process which is damaging the function of a nerve. This is neuropathy. Maybe you are familiar with the term neuritis. That means it's an inflammation of a nerve. The nerve is inflamed. Like a joint can be inflamed, then we are talking about arthritis. When a nerve is inflamed, we are talking about neuritis. That means it's an acute inflammation of a nerve. When we talk about neuropathy, then we are not talking about the acute inflammation. Then we talk about something which is damaging slowly the nerve. And it's not only inflammation, even if there is some inflammatory component. It's somehow a process, a pathological process, which damages the function of a nerve. This is neuropathy. Neuropathy is a process which damages the function of a nerve. It's a pathology. It's not normal to have neuropathy. It's somehow a pathology. Something is going wrong with that nerve. And this process is damaging the function of that nerve. And it's more or less something slowly. It doesn't start from one day to another. If you look carefully to this patient, you see it started somehow slowly. And neuritis can start very quickly because it's an inflammation. It comes, it's there, and then it goes. Neuropathy is more slower. But it's a process, a pathological process, which damages the nerve, the function of the nerve. Now, let's see, where are these nerves? We have the central nervous system, that means brain and spinal cord. The whole spinal cord, which is in here in the spine, coming down until lumbar spine. The brain and the spinal cord, the tail of the brain, this we call central nervous system. Neuropathy is not the problem of central nervous system. It's the problem of the peripheral nervous system. That means the nerves, they are coming from the neck to the arm, from the lumbar spine down to the foot, from the thoracic spine coming here to the chest, to the organs. Neuropathy is a problem of the peripheral nerve. Peripheral nervous system. The same problem occurs in the brain, but then we say it's encephalopathy. It's somehow a process who damage the function of the brain. It's encephalopathy. We are talking about the peripheral nervous system now. We should not bother about problems down the central nervous system. So neuropathy is a problem of the peripheral nervous system, of the nerves from the neck down to the hand, or from lumbar spine down to the foot, or for the thoracic spine here to the chest. Peripheral nervous system. The peripheral nerves, they are going from the spine to the periphery, therefore peripheral nervous system. Neuropathy is a problem of the peripheral nervous system, the nerves which coming from the spine going to the extremities. Can you understand the way I'm explaining it? Yes. Just please interrupt if something is not clear. So neuropathy, we say, it's a pathological process who is damaging the function of a nerve. And we say it's a problem of the peripheral nerve. So if we look at the patient, we can see most of the patient with neuropathy problems, they have it on the feet. These patients, they come and they say, my feet, they are somehow burning, or they are tingling. I have pins and needles, or I have cramps in my muscles. Or they say, I don't feel the ground. It seems as if I have a sock on my foot. I don't feel it really. Or sometimes they say, my foot feels so cold, but when I'm touching it, it is not cold. Or have a burning sensation. Or sometimes they say, my foot is so cold, and when I'm touching it, it seems that foot is dead. Problem of circulation. So these are just a few of the symptoms of neuropathy. Normally, people, they have it on the legs. And normally you see it's on both sides. We call it's a symmetric neuropathy. It's on both sides. This is quite normal. Do you remember patients which you were treating, which were under ART treatment? They have the medicine, antiretroviral medicine for HIV infection. Have you seen patients who are complaining about this problem? Yes. Yes. Have you seen TB patients who are complaining about this problem? Yes. Have you seen diabetic patients who are complaining of this problem? Yes. Yes. These are normally the patients. Have you seen old people? They had that problem? Yes. You can see old people. In old age, it's quite typical. If you have 80-year-old people, you will find it. Now, even in the animal medicine, you will find it. Have you seen old dogs? They were just pulling their back legs. They were no longer stable on the legs behind. Have you seen that? Old dogs, when they are old, they're already white in the face, they were maybe 10, 12 years old, and then somehow the back legs are no longer strong, they're even falling down sometimes. This is the same problem. They have neuropathy. Even animals, old animals, can show that problem, that their long nerves, and imagine the nerve, the sciatic nerve coming from here, going down to the foot, is longer than 1 meter. This is a very long wire, this sciatic nerve. The long nerves, they more easily get neuropathy. So in old age, it's somehow a process of aging that these nerves somehow degenerate. As the joints degenerate, long nerves in old age can degenerate and they get neuropathy. So summarizing, we can say neuropathy normally shows itself in the feet, and normally in both. Less often in the arms. Less often on one side. but it occurs. And the symptoms are these neurological sensations of pins and needles, tingling, burning sensation, somehow the sensation I'm cold but it's not cold, or sometimes it's really cold, numbness, cramps at night, clony, this spontaneous movement, difficulties to walk. This is typical, these are typical symptoms for neuropathy. And normally, as we said, it's symmetric, rarely it's on one side. It's typical that it is slow onset. Very rarely it comes by one day to another. When you talk to them, they say, yes, for months I had already cramps, but then my feet got numb, and now I have this burning sensation. So it's slow onset. So from these symptoms we know the nerve is damaged in his function. Now let us ask, what's the reason for neuropathy? What is damaging the function of the nerve? What makes these people walk somehow strange? What creates these nasty pains? And we can say there are three groups. One of three neuropathy patient has this problem from unknown cause. We don't know, so we call it idiopathic. May Angelica, if you please can write that on the board, idiopathic. Idiopathic means it comes and we cannot find a reason. It comes. And one of three neuropathy patients has a problem and we don't know why. So it can be degeneration, it can be age, maybe there was a virus. You cannot find the cause. 1 in 3 has neuropathy because he's a diabetic patient. So, Hashiba, idiopathic or diabetic neuropathy. So, diabetic patient, they tend to lose function of the nerves due to diabetes. The diabetes is somehow aggressive to the nerves and damages the nerve. So 1 in 3 is a diabetic neuropathy. So if 1 in 3 person is idiopathic, 1 is diabetic, that means 1 patient of 3 neuropathy patient has an acquired neuropathy. That means he got it through to something. And I will tell you what that something is. Acquired neuropathy can be due to trauma. Let's say that patient had a problem on the foot, he got a POP, that POP was too narrow. It will somehow pressurize the nerve on the outside of the lower limb. When the nerve there is pressured a bit too much, it will suffer, the nerve won't work anymore properly, and you will have neuropathy on the foot. Or I have a patient, in wintertime he was walking, he's an elderly person. He had a dog, and he was walking with that dog. The dog was pulling on the rope, that old and that they fall down. And there was a stone, and that stone hit his leg, exactly there where there was a nerve. So he hit that nerve on that stone. From that day on, slowly, he developed neuropathy because the stone, that trauma was hitting the nerve. And then the nerve somehow degenerated. And he got this neuropathy. So you can have it due to trauma, contusion, distortion, a bang through to something, falling down. Or very typical is the neuropathy on the arm in drunken bondate. You know, they drink, and then they're so much drunk that they cannot walk anymore back home. So they say, oh, I'm so drunk, I better sleep. And they lie down somewhere. And then they are lying on the side. I can show you. So they're just being so drunk, and then they're lying like this, having the head on the arm, and they're lying maybe on a bench or just on the floor. And being so drunk, they just relax, they don't feel, and they have pressure here on the radial nerve. Being drunk the whole night, sleeping without moving, that nerve gets damaged, and then they have neuropathy. We have seen many boys with the drop hand, you remember? They were tortured with a rope. So that rope was squeezing the nerve, damaging the nerve, and as a consequence, the nerve was damaged in its function, and he got neuropathy. You see now, the radial paralysis is a type of neuropathy. And when they don't recover really and have some residual symptoms, we can say this is a traumatic neuropathy. So when we talk about acquired neuropathy, then we can say many of these patients, they had a trauma. So trauma was damaging the soft tissue, trauma was damaging the nerve, and then neuropathy is developed. Acquired neuropathy you can have due to a virus, herpes virus. There is this, we call it post-herpes pain or post-herpes neuropathy. That means the herpes virus was infecting the nerve, and somehow that nerve got a damage and doesn't work anymore properly and creates too much pain. Due to a virus, HIV virus is creating many forms of neuropathy. So sometimes our HIV patients, they are not only neuropathy patients because they are under medicine. They can have it primarily by HIV. So HIV can infect the nerves and can create neuropathy. This is one way due to viral infection. There is a very famous sickness, we called it Guillain-Barré. It's a French name. It was Mr. Guillain-Barré. This is a virus infection which comes in by the nerves. That virus is walking up the nerves, and while walking in the nerve, in the axon, in the nerve fiber, is paralyzing that nerve. These people get completely paralyzed, and after months, sometimes 2 years, they recover and can walk again. We had cases like this. This is a neuropathy. So viral infection can produce neuropathy. Then we have some sicknesses, some diseases which create neuropathy. So it's disease-related neuropathy. So we have virus-related neuropathy, trauma-related neuropathy, and disease-related neuropathy. And we have metabolism-related neuropathy. This is quite common. We have people who drink chronically too much. They are suffering of alcoholism. So when somebody is drinking too much, he will have problem with the assimilation of vitamin B, B12 and others. So with time, he will lack vitamin B12 and he will develop neuropathy. Malnourished people develop neuropathy. It's a problem due to not proper nutrition. So the metabolism, the body somehow creates a metabolism which is producing neuropathy. Therefore, we always say, when we have to treat a patient with neuropathy, they need nutritional advices. Good nutrition, Good health is number one in the treatment of neuropathy. There is no sense to treat neuropathy without controlling and organizing a good nutrition. If there is malnutrition, you will be in difficulty treating that neuropathy if you are not changing the problem of nutrition. So it's primarily the problem of nutrition. So we have metabolic neuropathy, we have the disease-related neuropathy, we have the virus-related neuropathy, we have the trauma-related neuropathy. So you see, acquired neuropathy can be due to many things. These are the reasons. So all in all, let's remember, 1 out of 3 neuropathy patients, we don't know why, it's idiopathic. 1 out of 3 is a diabetic patient, and 1 out of 3 has acquired neuropathy. And there are many reasons. That means all our neuropathy patients, they have to be screened before they are sent to physio by the doctor. And the doctor has to find out, is this idiopathic, is it diabetic, or is it acquired? The doctor has to find out if that patient needs other treatments as well, and he will find out which medicine that patient needs, etc., etc. So neuropathy patients, we are treating together with the doctor. Now, there is one group of acquired neuropathy we have to remember because we see them so often. This is somehow toxin-related, or we have to say drug-related neuropathy. If you're exposed to poison, you can get neuropathy. You remember, some bombay, just when they come to deliver the baby, few days before it comes, they drinking mercury. It's somehow traditional belief. If you drink a little bit of mercury, somehow you think the baby comes out like that, mercury is moving, like this. Do you know that, okay? This mercury is poison. This mercury will leave in the body substance. It's not only so that you are drinking it and then it will go to your intestine and then it will come out the same day. There will be leftovers in the body which the body is not able to digest. This, we call it a heavy metal, this mercury, relates to a very sublime but a very gentle intoxication. And that runs to the nerve and can produce, not today, not tomorrow, but after a while, it will produce neuropathy. So this tradition or this belief, drinking mercury to have a better, easier delivery, is really dangerous to the nervous system. And unfortunately, not only to the mother, even to the child. You can evoke neuropathy. Therefore, it's so important that we discuss about that. And then we really make people aware drinking mercury is something very, very, very dangerous. It doesn't help to have a better delivery at all. It doesn't change. And it is heavy for the neurosystem. There are other of these toxins which can make it. Sometimes even from colors when they are painting, modern colors which may be the very strong colors, they have a lot of chemicals in it which are poison to the nervous system, and they create this type of neuropathy. So you can have toxins which are creating, sometimes mushrooms, things like this, bad food and so on, but mainly chemicals make it. But drugs as well. Some drugs, they are helpful for something, but they are harmful for the nervous system. Unfortunately, many of the HIV drugs, they are somehow toxic to the nerve. But we have to give it to the patient because there is no better medicine. At least we have that, at least HIV infection can be controlled and things become better. But while doing this long-term ARV treatment, we are exposed to some toxins in this medicine which can be harmful to the nervous system and create neuropathy. This is a collateral effect which we have to accept. But drugs can be harmful and create neuropathy. Therefore, in HIV patient under treatment, we see it quite often. This is drug-induced neuropathy. We always say, you have to eat the less sour apple. If you have two apples, one is very sour and the other is less sour, and you have to eat an apple, you eat the less sour. So that means treating HIV with these drugs is better as not treating them with that drugs. If I prevent neuropathy while not treating HIV, I'm not better, okay? It's better we treat HIV and then maybe as a side effect we have neuropathy. You're still alive, you can live with neuropathy, but with HIV you won't live a long time without the drugs. So therefore we have to take it. But there is a problem with neuropathy. And what we can see, and this is the good news, the lucky news, if we identify the neuropathy patient early and we start with physio, they really cope much better with the symptoms. Even they are drug-induced, we can improve quality of life for them. So let's do it. Even we know it comes from the drug. Anyway, we do it and they are better. And in all the other neuropathy, if we are patient and we work intensively, teach the patient how to do it, they are better. So this is the good news. So now the question, what creates neuropathy? We could say it can be idiopathic, we don't know, or it can be diabetic, or it can be acquired neuropathy due to something. And that is trauma, virus, diseases, HIV, drugs, or metabolism. Can you follow me? Okay, please, 2 and 2 together, just discuss what does it mean, acquired neuropathy? Just 2 by 2, just discuss, try to explain one to the other. What does it mean, acquired neuropathy? Discuss with your neighbor on your left or on your right. Now we were studying what is neuropathy, what are the symptoms of neuropathy, what are the causes of neuropathy. Now let's go a little bit deeper in it. There are different types of neuropathy. They are all written nicely in that scriptum you have, but let me explain you a little bit. There is a type of neuropathy, we call it mononeuropathy. Mono means one. If only one nerve has that problem of neuropathy, if only one nerve is damaged in its function, then we can say this is mononeuropathy. Let's say I have a patient and the patient is only on the outside of the arm, maybe on the back of the hand, tingling. Maybe weakness in extending the fingers. Then it is a mononeuropathy of the radial nerve. Or maybe he was tortured, not for a long time, maybe an hour. Now that hand is somehow weak, he cannot really extend. Then we could say this is mononeuropathy due to trauma. It's only a radial nerve. When one peripheral nerve is damaged, we can say it is mononeuropathy. Just one nerve. Then, when many nerves are damaged, and this we can see very often, people come and they say, my whole foot is somehow numb. The inside, the outside, the lower part of the foot, the upper part. It's somehow numb. It seems I have a sock on my foot. It's tingling the whole foot. Then we know this is not only one nerve. These are several nerves, many nerves. So then we call it polyneuropathy. May Angelika, if you please can write mononeuropathy and poly. Ja, aber das ist noch gesehen, um die Aufmerksamkeit zu fokussieren. Mononeuropathy, one nerve. Polyneuropathy, many nerves. Very often you see polyneuropathy. Seldom you see mononeuropathy. And now there is a special type of neuropathy. We call it multiple mononeuropathy. That means one nerve may be on the arm, another nerve down on the leg, and one nerve in the face. You have on 2-3 spots in the body, you have mononeuropathy. So one nerve on the arm, one nerve on the leg, maybe one nerve in the face, then you have on 3 spots, you have neuropathy. So many individual nerves to the same time are affected. Then we say this is multiple neuropathy. Multiple mononeuropathy. And this is normally due to systemic problem. Virus, drug, toxins, metabolism. Mononeuropathy very often is due to trauma or problem in the tissue. We had a patient, she had a bit problem on the elbow and she had pins and needles here on the hand. This is mononeuropathy due to trauma on the elbow. The tissue was too tight. We had to loosen with massage and mobilization the tissue. The nerve got free again, and then the problems went away here on the finger. We call it as well nerve entrapment. The nerve is somehow squeezed due to tissue, hard tissue. The nerve is squeezed. This is mononeuropathy, traumatic. Multi-mononeuropathy normally is due to virus, due to toxin, metabolism, due to a problem which is systemic. There is something in the blood going which creates this multi-mononeuropathy. Sometimes you have a patient, they say, I woke up this morning and now I have just double picture. I see everything double on one eye. So the opticus nerve is somehow inflamed and it can become chronic. Then we know we have opticus neuropathy. So we have, let's remember, mononeuropathy, one nerve is affected by that problem. We have polyneuropathy, many nerves are affected by the problem. And you have the multiple mononeuropathy, that means one nerve here, one nerve there. Now, we will have a detailed look what happens to that nerve. We have to understand that for doing then the physiotherapy. In a peripheral nerve, and you can imagine it's like a tube with many fibers in it, like an electric wire with many fibers in it. In a peripheral nerve, you always have fibers. We call it motoneuron. These are fibers which are going to the muscles. They activate muscles. Motoneuron. These are nerve fibers coming from the brain, the spinal cord, going to the muscle, and they are activating, they're creating movements. In a peripheral nerve, you have as well sensoric fibers. That means these are the fibers which transmit sensation. So they are going from the periphery up to the brain. And in every nerve you have autonomic fibers. That means these are fibers which are regulating circulation, temperature in the tissue, and so on. Now, when neuropathy occurs, you can have problem on the motor neuron. That means the muscle is not working properly. When the motor neuron is somehow affected, the muscle is not working properly. Patient will say, "Oh, my foot is weak. I cannot lift it up," or "it's not reacting normal. It is somehow not working properly with my foot." And you will feel the muscle is weak. If the sensory fiber is affected, the feeling, the sensation is not good anymore. So they will complain of numbness, pins and needles, tickling. Somehow funny sensations. If the autonomic fiber is affected, they will have problems of circulation. We have now a patient, she's a diabetic neuropathy patient, and she says, "My finger is so cold." And we were treating her with Mechashliso and Mesophia, and we were touching the finger. And Mesophia, how was that finger? Was it really cold or not? Mesophia. That finger of our patient, she said, "I have such a cold finger." Was that finger cold?
Yes.
Yes, it was really cold, like from a dead person. So cold. That finger here was perfect. That finger here was perfect. But that finger, cold, like the finger of a dead person. That means the circulation of that finger is really disturbed. So that means that may, with the diabetic neuropathy, has a problem on the autonomic fibers. So we can say the nerve has three fibers, three types of fibers. The motor neuron is going to the muscle. If it is affected, you have somehow a problem with movement. We have the sensory fibers for sensation. If it is affected, you will have somehow changed sensation. Numbness, tickling, pain, cramps, things like this. We have autonomic fibers. If we have a problem there, you will have problems of circulation. Circulation will not work properly. That means you will have cold parts of the body or hot parts. Both is possible. Color changes, things like this. So the neuropathy can affect one of these fibers, or they can affect all of these fibers. So if all of these fibers are affected, that person has probably difficulties to move the arm properly. They will have strange sensations and pain, and they will have circulatory problems. Autonomic nerves go as well to the organs, to the stomach, to the gallbladder, to the liver, to the kidney, to the intestine. So if we have neuropathy there, if more a nerve going to the organ is affected, we will have organ dysfunction. It means we can have diarrhea, we can have constipation, we can have problems in digesting. This is a type of neuropathy. So you see, many problems occur due to neuropathy. By understanding the mechanism, we can understand better. So now we will go to a break. After the break, we will finish a little bit of theory, and then we start to think about how can we treat these people with physiotherapy. And we will see how they really benefit from physiotherapy. Physio is an important part in the treatment of neuropathy.